when we talk about Sam's nose, let's talk about that first. So tell me what your concern is, and then we'll kind of figure out what we want to do.
I just don't like the bump on my face. I didn't get it till much later in my life,
Okay.
like mid-high school, or later in my particular life.
Yeah.
And I just wish it was a softer feature from the side especially.
So I think that in terms of how it goes, your bump, yeah, it's true that your nose, the impression that your nose gives is of going kind of this way.
Right.
So, which is not that difficult to correct. All we have to do is put a little bit of filler over here. The reason why it looks like it's going this way is because there's more tissue here, like in some of this area of the sidewall, and there's less tissue here, like in some of this area of the sidewall, and the bump is a little bit sharp over here, and not as sharp over here. So if we can just blend those things and put a little bit more volume on this side, I think it'll be nice to make her nose look centered. The other thing is, and then the other interesting thing is what happens on the profile. How to make your nose less noticeable or less obvious is to camouflage this bump, because the bump will always make your nose look bigger because it attracts attention. If we can make that bump go away, then your nose blends into the rest of your face. You don't notice it as much. It looks smaller. And this is something I say all the time about with non-surgical rhino, is that when you have a cosmetic imperfection, droopy tip, bump, a twist in the nose, something that attracts attention, it makes the nose look bigger and stand out from the rest of the face, and it makes it and camouflaging that, or making the nose straight, or making the nose symmetric, really makes the nose look smaller, look like it blends into the rest of the face. So the plan would be, to my mind, from the front, add here, blend this. From the profile, turn, is lift this a little bit, and then lift the tip very, very slightly. I don't want to project the tip more than it is already, but if I need to bring it out just a hair in order to make a straight line, I will do that, because it's worth it to make that straight line and make that nose blend into the rest of her face. Okay, so first thing we're going to do is transfer voluma into the BD syringe. Again, it's a 0.3 cc 31 gauge BD needle and syringe fixed. I'm using voluma 21 gauge 1-inch needle on the syringe, and I'm putting in 0.2 cc's, not more than that, because then it's hard to put the plunger in if you put in more than 0.2 cc's. Everything is sterile so far. I've recapped the needle, placing the plunger back in, nice and clean, 0.2 cc's, right? And then flows really easily. And then the question is, where do I start? I like to start, if possible, at the top at the radix, because it's not a very painful area at all, comparatively speaking. Compared to the tip, it's certainly less painful. And so then the patient is kind of, a little bit more comfortable, because they're always nervous before the beginning of the procedure. And so when we start at the top, it's not very painful. I'm like, okay, this is all there is to it. It's not really that bad. And they're like, okay, it's not really that bad. And so then I can proceed to the other areas, which like the tip, which might be a little more painful, but then they're a little bit more open to the kind of prospect of having a needle come out their face, if they know that it can be not so bad. So, all right, so let's inject the radix. The radix is the area that I get concerned about for bad adverse events, so like blindness. So this is the area. The tip I get concerned about ischemia and necrosis. The radix I get concerned about blindness. Sorry. You're not gonna have. We're gonna be okay, because we're very, very careful. Why? Supratrochlear artery comes here. Dorsal nasal artery comes right over here. These are both branches of the ophthalmic. If you put enough filler at enough pressure, and you happen to be intravascular, that's how blindness can occur. We're not doing that. We're putting small amounts of filler. We're doing it under low pressure, and we're always moving the needle to be as safe as possible. But these are branches of the internal carotid, right? Even if we're talking about the sidewall where there's branches of the external carotid, it's still, there's a lot of connection between the internal and external system in all over the face, but especially in the nose. I mean, the dorsal nasal comes into these vessels here. It's all plexus. So there's not really an area where you're more safe or less safe. There's always connections. But in the terms of radix, it's an area where there's direct access to the internal carotid vasculature, of the ophthalmic artery in particular. So you have to be careful. So little stick here. Tell me if this is bad.
It's good.
Are you pretty numb from the numbing cream?
Mm-hmm.
Okay. So I'm going fairly deep, super periosteal, and then coming out as a column. Good. Already it's a lot better. Already we're blending the bump into the rest of her nose. Maybe I'll do a little teeny bit more up here, and then we'll go to the bottom. But yeah, I mean, I'm injecting 0.01 cc's with each injection point. Very small amounts. I can be very, very precise because the nose is a midline structure. It's where every fraction of a millimeter really counts in terms of contour. You want to be as precise as possible so that these lines are straight, everything is symmetric, and everything looks really, really nice. So already your bump is pretty much gone.
Mm-hmm.
So that's good. Go ahead and ice here. So now we're going to do a little bit. Go ahead again. Sorry. I'm going to do a little bit on the tip, and then just make it really a nice straight line. And it should be good. Now you'll notice that when she smiles or when she speaks, her tip tends to dip down. When I put a little bit of filler into the tip, it gives it a little bit more structure, so it tends to dip down less. If we want to really make that a lot less, we can always put a little bit of Botox into the depressor muscles here. So when I'm injecting the tip, little stick right here, shouldn't be too bad. You okay?
Mm-hmm.
So I'm injecting here. My goal is to recreate the tip defining points. Just a little bit of filler here and recreate some of that structure. A lot of times when you have a rounded tip, recreating the tip defining points gives it structure and gives it definition, and that's usually really quite nice. So now we have, the tip has come up a little bit. Now we just have to blend it into the rest by filling here. And making sure that we are in the midline, right? Good, I'm on cartilage and coming out. Let's see if that's enough. Good. And then just a little teeny bit right there. All right. So here we're just trying to bring the skin of the ala down a little bit. Okay, just do a little bit more. Okay, so now what we want to do is go to this area. So fill the sidewall and fill a little bit of the side of the dorsum here, so that on the 45 degree, she's more smooth, and on the front on, she's more symmetric. So in this area, I'm concerned about the lateral nasal vessel and the angular. And so I want to be, again, careful about how much I inject. I want to be careful about how what the pressure is under which I'm injecting. And aesthetically speaking, I want to be sure that I am creating a natural, smooth contour. Okay, hold this here for a sec. Good. Now I'm going to refill this. So what I want to do now is really build up the side of her dorsum, so she doesn't have that curve on the oblique view. Open your eyes for a sec. You have to, when I'm evaluating the symmetry, any kind of symmetry of the face, I find that it's easier to do when someone has their eyes open than when they have their eyes closed. It's hard to aspirate with this syringe and needle, so I don't rely on aspiration in general. I don't think that it's a very accurate measure of safety, and I think it can give you a false sense of security. So, because once you're underneath the skin, aspirating, I think, takes enough, especially with a filler as thick as Voluma, aspirating takes enough muscle force where I don't think there's a way to guarantee that you're in exactly the same place. And underneath in the face, a few millimeters, or a fraction of a millimeter, is the difference between being inside a vessel and not. So I'd rather rely on this safety techniques that we've been talking about. So profile, oblique, good. So this is really good, and I think that it's going to settle a little bit, and but I always program in a follow-up visit to each of these procedures. So at 1 month they come back and we do like a little touch-up, and then at 6 months they come back and we do another touch-up if necessary. But at 1 month I think is usually quite necessary because it settles a little bit, and we need to refill it, because right afterwards it looks really good, but then there's a little bit of settling that happens with the filler. A note about the filler that I'm using. I like Voluma for a few reasons. One is that it gives enough lift to where to where the tissue comes up enough to get definition and to get contour changes that I need in the nose. It's not as much G' as Radius, but that's okay because it's dissolvable, and it's soft, it looks natural, and it lifts the tissue enough for my purposes.
Wow.
No, you don't have to really actually say that. You can be honest.
No, that's crazy.
But that's pretty good, right?
Yeah.
So you have and if you see on the profile, it's not perfect. You still have a little teeny bump, but who cares? It looks really natural, and it looks like you, but just less bumpy, and it blends in. You see what I'm talking about in terms of blending into the rest of your face?
Totally.
It doesn't stand out as much, and so and especially once we bring this forward, it'll be really nice.
Yeah.
So
and then the nostril area too.
Yeah, that came down nicely.
Crazy.
Yeah.